Thank you. I want to thank all the three panelists for their excellent presentations. We have about 25 minutes for questions and answers. I've been monitoring the Q&A chat box, and thanks. We have a lot of questions that have come in, and I encourage people to keep them coming. Let me start off by asking any of the panelists. Several of the Q&As have really focused on the role of OSHA and regulation for non-traditional respirator wearers. There was a colleague, I think, from Europe who pointed out that there's a national mandatory program in restaurants and schools. He was asking, well, do we have such things in the United States? Another questioner talked about meatpacking workplaces. Are they regulated by OSHA? And Joe, when you were presenting and talking about the U.S. Forest Service, it struck me that there's some cultural change that has slowly been taking place in terms of understanding that respiratory protection is necessary beyond the bandana. So I think it raises the larger question that I think the panelists or this workshop probably needs to address, and that is, what is the connection between OSHA-required respiratory protection programs and the non-traditional user, particularly in workplaces that are not historically used to thinking of themselves as needing to have OSHA-mandated respiratory protection programs? I would add, Bill, you talked about custodians in schools. I think schools as a group, for example, are not traditionally thinking of themselves where they're going to have, a respirator fit testing program and so on.
Well, a lot of these non-traditional workplaces do have some exposure hazards where respirators ought to be used. And a respiratory protection program ought to be established. If it's a private sector workplace, OSHA applies. And if there are inhalation hazards where the employer requires a worker to wear a respirator in the private sector, then the OSHA standard, respiratory protection standard, applies. But in my experience in these industries and others, you go through the whole list that I went through, there are a lot of these sort of non-traditional workplaces and non-traditional workers where there's little or nothing being done to address respiratory protection hazards. And if there is, it's just a small slice of what's required in a full-blown respiratory protection program. They hand out respirators. And that's it. No training, no fit testing. And, workers who don't really know think that, well, that's providing me with protection. I've got a good employer here. When in fact, you may not be getting the full protection that respirator is designed to provide. In fact, you might be wearing the wrong respirator. Schools are a little bit different situation. Schools are public employers. We're talking about public schools, not private schools. Public schools. So the way the law is crafted, about half the states have a state program that covers schools. So OSHA regulations, the respiratory protection standard would apply in those situations. But in the other half of the states, schools, public schools, aren't covered by OSHA. And, it's really literally the Wild West. There's no requirements.
Joe, does OSHA cover the U.S. Forest Service? Joe, you're on mute. There you go.
Yeah. So since we are a federal agency, we've had other incidents, not, respirator related, but other incidents, we've been cited by OSHA, but I'm not sure with us as a federal agency, it holds much weight. compared to maybe our state cooperators, our VFDs, our contractors. So that's another complexity within us, is that we have multiple organizations all responding to maybe the same wildfire, and all have different kind of regulatory issues, I guess you could call it that.
And Kevin, I guess I'll turn it to you for the workers in informal employment relationships. I noticed one of your pictures, a worker looked like an N95, and he had facial hair in one of the photos. How do you apply the OSHA standard or not to workers in informal relationships?
Well, I mean, at this point, the OSHA standard doesn't apply to those kind of informal work arrangements, particularly in residential settings. Although here in California, there actually is currently an effort to extend OSHA protections at least to domestic workers, so folks who would be hired in informal ways at residential properties, and that effort is moving forward now. I think there's a lot of questions from all sides as to just how that would look in practice, and what effect that would mean for, does that mean OSHA inspectors are going to be going into private homes and issuing citations? Mm-hmm. But there are some efforts to try and grapple with that issue of the current sort of lack of protections, I suppose, for those informal sectors.
Yeah, a number of our listeners in the Q&A are commenting on this issue. A listener from the Veterans Administration comments that OSHA does apply to the VA, but cannot fine the agency. So that's another little wrinkle. And that fitting a non-traditional workplace into a traditional respiratory protection program, managing training, fit testing, and then the issue of medical clearance, and how that would be performed if respirators are used in these non-traditional workplaces, who's responsible, and what would be the logistics of complying with the full respiratory protection program, which of course includes the medical aspect. A number of comments about the need for education and training, understanding the difference between a respirator and a mask. Kevin, you touched on that. Do you want to say anything more about education and training, Kevin, beyond what you've said?
Well, I guess I just want to re-emphasize that the training needs to include workers, but it really does need to include employers as well. I mean, employers need to understand that, for example, in the case of say, our wildfire standard, where there are actually requirements, employers need to understand that it's not just about handing out a respirator, sort of as Bill was saying, but that there's a whole program that has to go around that employers have responsibilities as a result. I think it's also, even beyond that standard, I think making sure just employers understand what the potential risks are of just handing out an N95 to a worker without doing proper testing and medical evaluation. So that education really has to happen on both sides, and including, I would say, homeowners. I mean, as these issues around wildfires in residential areas become more and more prominent, it's not a bad thing that folks have opportunities to work in responding and cleaning up to those wildfires. But homeowners who are relying on that workforce really need to understand what they're asking people to do, the potential risks that they're putting them at, and what their responsibilities ought to be in hiring these folks.
Thanks. One of the questions pertains, I think, very appropriately to keeping in mind that a respiratory protection program for the non-traditional user needs to be integrated with an overall occupational safety and health program. Pointed out, skin protection, hearing protection, and so on. Joe, I think that's a good question for you, because I know you've been studying a number of aspects of wildfire health and safety. Thoughts about how a respiratory protection program integrates with the other efforts around overall occupational safety and health for wildland firefighters?
Yeah, I definitely agree that it needs to be this more holistic approach. I think a lot of times we try to say these things are mutually exclusive when they're exactly the opposite. They need to all be part of this greater wildland firefighter health and safety effort. And I think from the federal agencies over the last decade, that transition is being made. We've done some work on hearing conservation the last couple of years out there in wildland fires, especially around aircraft. We're beginning the initial stages looking at more dermal exposures to firefighters and potential carcinogens. And so I think overall we are making that effort to make it more of a holistic total worker health versus these hazard specific PPE or mitigation measures.
A couple of other questions or observations have come in around hazard assessment. These questions, actually, a couple of them pertain to COVID, airborne transmission, fine particles, understanding the type of respiratory protection that are necessary. So I guess the broad question is thinking about how, in implementing respiratory protection programs for the non-traditional wearers, how do we effectively perform hazard assessment to determine the type of PPE that's necessary for those users? Who does that? What kinds of programs? One questioner asked NIOSH whether they would be doing health hazard evaluations on these workplaces to gather the research information that would drive the proper PPE. Any thoughts about that?
Well, when you get into recommendations for respiratory protection for COVID, I mean, sort of the bottom line is a filter and face piece respirator, an N95, and that's sort of the base. That's the baseline for high level exposures like aerosol generating procedures. The recommendation typically goes to a powered air purifying respirator, and that's kind of the cut. We don't have an exposure level or standard for doing traditional industrial hygiene sampling for the virus, but I think the key thing is to move away from, at least from a worker protection point of view, is to move away from devices that aren't and don't offer respiratory protection, and move workers who have the potential for risk and exposure, rather, and put them in respiratory protection, particularly when the evidence is mounting that airborne transmission exists. And we owe it to ourselves to ensure that those workers are as adequately protected as possible. And the use of cloth face coverings doesn't get the job done, in my opinion.
I'm gonna read most of this very last question that came in because I think it's a very thorny question. Traditional workplace regulations favor engineering controls and allows PPE as a last-ditch control, right? It's in the traditional hierarchy of controls. And so the respiratory protection standards can be, for non-traditional users, fairly restrictive, citing the assigned protection factor of 10, penetrating particle sizes, demonstrating a fit factor. And the question is this highly protective approach appropriate for non-traditional users and non-traditional workplaces? I know that that's a question that's come up in California with the standard on wildfire smoke for these non-traditional users. To put it simply, sometimes the question comes in, well, is any N95, even not fit tested, better than nothing? So to the panelists, would you ever want to relax the OSHA regulations regarding assigned protection factors, fit testing, compliance with the OSHA respiratory standard? Or would you want to insist that for non-traditional users that we conform to the same levels of compliance and standards and conformity that we use for traditional users?
Well, I'll weigh in. Of course, the same provisions need to apply to all workers who have exposure risks, and that means full compliance with the respiratory protection standards that are in play. Better than nothing this is from my perspective, and I think from most workers' perspective. That's a step in the right direction, but that's not good enough. No, I think the framework for these non-traditional workers in industries and environments where you don't typically have respiratory protection programs, they have to be afforded the same level of effort to protect them as construction workers or those working in manufacturing, where we do have known and extensive exposure to inhalation hazards. The other piece about focusing on respirators, though, that you need to back up in the hierarchy and look at other ways of addressing exposures. For example, in meatpacking, in the German paper that came out that identified the exposures as being airborne transmission, they talk primarily about ventilation controls. There's a cold environment. There's a lot of recirculation of air. So looking at ventilation as one of the major thrusts to protect workers, and not just, shifting from the single ply cloth face masks that German workers have, but to use and implement engineering controls first before you start slapping respirators on people.
Well, let me turn that question over to Joe. For wildland firefighters, do you relax or do you keep strict?
I don't know if I would say the word relax on the protection, but maybe the bigger picture. Back in the 90s, one of the concepts that was looked at for wildland firefighter respirators was a mouthpiece and a nose clip. And, it almost like a snorkel attachment into your mouth with this nose clip that was lightweight, small, that was able to filter out particulates and some other things. But it wouldn't meet the fit testing requirement. And the other thing with wildland firefighters is facial hair, because most of our federal fires are out in remote locations where daily hygiene with shaving is either not practical, or I'll say my wife and I, when I was a hotshot, got in an argument pretty much every time I came home because I wouldn't shower until the hotel on the way home during that assignment, because I chose sleep over shaving. And so most of our firefighters look like a ZZ Top band with long beards and handlebar mustaches. So I don't know if the word is relax, but just looking at different alternatives for creativity to meet the respiratory protection that is needed for this environment, because it's outdoors, it's not an enclosed space. There's very good ventilation, especially when you have a fire going, because that ventilation is what is causing that fire to get up and go. And so I just think there needs to be more opportunities for creativity in this non-standard environment while maintaining the protection of the individual.
Kevin, do you want to answer that in regard to the work that you do?
Yeah, I would agree both with Bill and Joe on this. And the way my mind goes in thinking about this question of relaxing OSHA standards is that I think it's important not to relax them both from a kind of protective point of view, but also from a sort of I think the standards provide good frameworks and guidelines for employers to follow. And I think even if Fed OSHA or a state OSHA program is not doing a sufficient job in actually enforcing the standards, I think it's very important still to have those standards on the books to set expectations for employers about what they need to do if, for example, if respiratory protection is needed, or to pursue other higher levels of protection on the higher field controls. Mm-hmm. So I think it's a framework that's important to have, and sort of as Bill says, I don't think we should be setting separate expectations for different workers.
Yeah, and I think that our commenters in the Q&A chat are, I think, agreeing with all the panel members in terms of the OSHA requirements and being sure we adhere. And a number of comments have been made about in the context of the COVID pandemic, the use of appropriate NIOSH-approved respirators, the importance both for non-traditional users that have been mentioned, schools, meatpacking plants, and other settings, but also even for the traditional users to be sure that that they are provided with NIOSH-approved and appropriately fit-tested respirators. That although this workshop is focusing on the non-traditional wearer, a number of comments have come in that even in our current setting, among the traditional user groups, there's been a lot of confusion and need to provide NIOSH-approved respirators with appropriate fit testing and other adherence to the standard. Let's see. Let me look to see if there's any other questions. I think we're coming close to the end of our session. John.
This is John Balms. And so I want to thank the panelists for excellent presentations. And I basically agree with what's been said, but I want to take this issue of whether I think you need to assess the risk that we're trying to protect people from. And in terms of wildfire smoke for outdoor workers, I'm not talking about wildland firefighters. I'm talking about folks in ag, for example, or the gardeners in the Pacific Palisades situation. I don't think we want the perfect to be the enemy of the good. And the risk to healthy workers, not with people who have pre-existing heart or lung disease, but to healthy workers from wildfire smoke isn't that high that you have to have a fit-tested N95. So I'm just saying that there's a practical approach when we're trying to deal with a large population of workers at some risk that we don't have to make everything perfect according to an OSHA respiratory protection program.
Thanks, John. I appreciate that comment.
Bob, can I ask? This really gets to Joe's. Joe's made a couple comments that I key in on, which is one, that the standard that came out for wildland fires looked and needed a device different than what it has existed, if I understood that correctly, and yet that device hasn't been made. And I think that will relate to the public use as well, in that maybe the devices that exist aren't usable within the context of a respirator program. And so that you need something different for these situations. And I think, Joe's comment about long beards and the way people aren't clean shaven says that, you need some novel types of respirators. And that is a whole other aspect of trying to do non-traditional workers and the public, I think. Not that I disagree with what Bill says, which is you need whenever possible, I think you do need the OSHA respirator program to ensure that respirators are being used well. But there are going to be situations where you need a different type of respirator that we haven't yet seen commercially, I think.
Thanks, Howard. Do we have any other questions from our workshop speakers, moderators, planners? Well, okay, we're almost right on time. I want to thank all our speakers again for provoking, I think, a very rich discussion, and all the folks in our audience who have typed in a lot of questions. I hope I've tried to capture most of them, but we'll have time later on at the end of the day, I think, to come back and loop back again to pick up some of these threads. We're going to be taking a half-hour break wherever you are. Here it's on the West Coast, I think it's a mid-morning second breakfast. For those of you on the East Coast, go take a stretch, have something to eat, and we're going to reconvene in 30 minutes at 1:45. Melissa, do you want to add anything?
You did a great job, Bob.
Okay, thanks. So we'll see you all in 30 minutes.